This is one of my favorite topics. When I was in dental school, in the textbook it would say there should be 2 millimeters of tooth display when the lips are in repose. Well, as I got into practice, I noticed that did not apply because there are different types of lips in repose. So as I studied this and photographed it over a period of years, I came up with 3 different lip types, lip positions with the lips in repose. The flat-lipped, the moderately arched lip, and the maximally arched lip. So it's not when the person is smiling, it's when the lip is in repose. The way you test the lip position in repose is you have the patient lick their lips and then say, maximally arched lip, moderate to maximally arched lip, moderately arched lip, half the tooth is displayed, moderately arched lip. This is a straight lip or a flat lip, and you classify it with the lip in repose. And you can see when her lip is in repose, you have just a bit of tooth in display. Now when the lip moves to full smile from lip in repose to full smile, this movement, if you mark the tooth right here and then you mark it right here, is about 7 to 7.5 millimeters. This is a moderately arched lip. Again, we're classifying it with the lip in repose. And you can see about half of her tooth is displayed with the lip in repose. Then when she goes into full smile, from here to here is 5 to 7 millimeters. Now, would you correct the gingival line? It depends on how long those teeth are. If they were 8 millimeters long and you took a periapical radiograph and it showed that the CEJ was subgingival, meaning if you measured on the periapical radiograph from the incisal edge to the CEJ, if that was 11, then you know this patient has delayed passive eruption. The tooth is not fully erupted, and part of the coronal part of the tooth is still under the gum. In that case, I would perform a periodontal crown lengthening procedure and expose the CEJ and make the teeth the proper length. This is not an unesthetic smile. This is a very aesthetic smile, but it's something to be considered. This is a maximally arched lip when the lip is in repose. And I classified this maximally arched when the entire tooth is displayed when the lip is in repose, even to the point that some of the gingival tissue is displayed. Now this is not even fair when it comes to smiling, because all she's got to do is just flick the corners of her mouth and she's got this gorgeous smile. This lip is not moving but about a couple of millimeters from this position to this position in the maximally arched lip when the lip is in repose. So the only lip type that can be used in determining the length of the central incisors is which type lip, the straight lip or the flat lip. And it can be used as a guide, a partial guide, in those patients, meaning you want some tooth display with lips in repose. With a maximally and a moderately arched lip, the only thing you can see is the incisal plane, and you know you want that to be correct and the teeth length to be correct, but you can't use the lip as a guide. And that's the Dental Minute.
Thank you all so much for joining us on this week's episode of the Dental Minute. Press subscribe right now and get excited because we are coming at you next week with part 2 of the Aesthetic Concept Series, How Phonetics Change When Lengthening Anterior Teeth. You will not want to miss that episode. See you then.